Okay, so we've had a lady come in today she's getting a painful lesion on the tip of the toe. You can see just under the scalpel there. She's been to a nail salon to have these painted and cleaned up, but it doesn't seem to be helping at all. So she's had them clipped down. And if we see this quite a lot actually, when you get a little bit of a claw toe, it causes pressure right underneath the front edge of that nail, and it causes this callus buildup. And it almost forms this line of like a corn across the front of the toe, so it feels a little bit like a foreign body in there, and it gets very painful, and you can see it starts to break down and cause a little bit of bleeding, and sometimes some of the little hemorrhages under the skin there. You can see the black dots. Quite often you'll also get a macerated portion of the tissue which looks a little bit white if the pressure is really bad. But this one's an easy fix actually. All we do is shorten up the nail and then clip back all of the hard skin under there that's causing the pressure and the pain. And it's really important on this type of patient to check the shoe fit. Make sure your shoes are long enough so there's enough room between the toe and the end of the shoe. You don't want any part of that toe touching the shoe. Particularly in your running shoes, we want to leave about a thumb width gap between the toe and the end of the shoe, and it'll help to limit this problem. But if they're clawing and she's gripping the ground with the end of that toe, which this lady does, really what we need to do is keep that nail short, remove this callus regularly, and then try and encourage her to wear a softer, more cushioned insole. Sometimes we can make a thing called a toe prop, which is like a little tube that sits just behind where the pressure is, so it takes the pressure off the tip of the toe. But this one's actually quite painful, so she's come in, and this will give her instant relief when she stands up on this one, because we've removed that foreign body type callus in the tip of the toe, so it'll feel like we've taken a rock out of the end of her toe, so she's no longer walking on that, causing the pressure. But eventually this one will build up if we don't correct what's causing it. So we'll take a little bit of a closer look at that and just see how it looks once we've removed it. And you can see there's that divot there where the harder skin or the corns come out of.